um, wrote, he wrote the book Unlearn Your Pain, and helping a lot of people with a lot of medical problems, and a lot of pain conditions. And anything else you'd like to add, Dr. Schubiner, that would be great. And welcome. And we're really excited that you're able to join us today.
Thank you very much. Well, it's a pleasure to be here. I have been doing this work for about 18, 19 years now. And frankly, most people are not very interested in what I do. So it's nice that you invited me. It's not that I feel lonely or neglected. I have lots of patients. In fact, I do get emails every day from people around the country and around the world who are interested in my kind of mind-body approach. But when most people first hear about it, they usually disregard it or ignore it, or sometimes they get very angry about it. Because you see, when people think about a mind-body type approach, there's a confusion that occurs between pain or other symptoms being all in one's head or coming from the brain. And there's a big difference there. And so what happens is when people feel that if people think that a doctor or anybody is saying it's all in their head, that's like the worst thing you can tell somebody, because that implies that their pain or their other symptoms are not real, that they're imaginary, that they're making them up, or that they're crazy, or it's their fault, or they want to have those symptoms. And that kind of thinking sometimes does occur in doctors. And so they say it's all in your head as a way of dismissing, being judgmental, being cruel sometimes, and I think basically being ignorant. Because it turns out that there's been, in the last 10 to 20 years, there's been a revolution in how we understand pain. There's been a revolution in the science of the brain and how the brain works. It turns out that all pain is created by the brain, which is kind of a weird thing to say. But if you touch a hot stove, your finger can't cause pain. Your finger can get damaged. The nerves in your finger will send signals to the brain. But it turns out that the brain decides whether to turn on pain or not. It's a decision that the brain makes, and it takes a nanosecond or a millisecond. It happens so fast that it seems like anybody who touches a hot stove would have pain. And generally it's true. Anybody who touches a hot stove will have pain. But as I'll show you, there are many times we know about where people have injuries and don't have pain. And there are many times when people have pain and have injuries. Are you guys with me so far? Okay. So to understand pain, you actually have to understand how the brain works. So how does the brain work? The brain works by something called predictive coding. So they compare the brain to a computer. Our brains remember not everything, but our brains remember a lot of stuff from our lives. And it takes all the stuff that we learned in our lives, and then it applies that information to our current situation to decide what to do. Predictive coding means that our brains create what we experience. Okay, this is very strange concept. Our brains create what we experience. So how do we see? Do we see with our eyes? Well, light comes in our eyes, but most of we don't actually construct the images with our eyes. We construct images to see with our brain. There's a part of the brain called the visual cortex. It's in the back part of the head, and it's the part of the brain that makes us see. And 95% of the fibers that go to this visual cortex come from within the brain. Why do so many fibers come from within the brain? Because our brain remembers what trees look like, and faces, and birds, and flowers, and all sorts of things. There's a tremendous amount of information that we have stored about how to see. And our brain will make a quick decision on what we see. Sometimes the brain will get it right. Oh, there's a red car. Yeah, everyone sees the same red car. But sometimes our brain will confuse us or be confused or create something that's not actually there. So an example is, if I gave you prism glasses that turned the world upside down, you'd see everything upside down. But you'd only see everything upside down for a couple of days. And then your brain would shift and make things right side up again. Our brains have the capacity to create what we see. Let's do a little experiment. What I want you to do is hold your head straight and turn your eyes all the way to the right. So you're looking at the far right, like the wall on your right. Hold your head straight and turn your eyes all the way to the right, okay? What do you see? Do you see the wall on your right? Right? If you look all the way to the right, you see everything to the right. It's like when you're driving, and if you're holding your head straight and you look in the side mirror on the passenger side, right? You see the passenger mirror. You focus on the passenger mirror, right? Okay, good. So now, keep your head straight, turn your eyes all the way to the right, and close your left eye. Keep your right eye open and close your left eye. Does anything change? Do you see the same thing as before?
Mhm.
Right. So when you look to the right and you close your left eye, you see the same thing as you saw when you had both eyes open. Okay, good. Now, keep your head straight, turn your eyes all the way to the right so you can focus on the far wall on your right, and then close your right eye and see what happens. What happens now when you close your right eye? Do you see the same thing as you saw before? No. When you close your right eye, you start seeing in front of you. So you know what that means is it's very simple experiment, but when you look to the right, your brain is ignoring your left eye. Your brain is only looking out of your right eye. Your brain says, oh, you want to see to the right? Fine. Let's just only use the information that comes from your right eye. We'll ignore what's coming from your left eye, because that's not what you want to do. Okay, our brain just makes these decisions for us, and it happens all the time. Okay, do you know anyone who's a police officer? Police officers have difficult jobs. They get called to scenes of all sorts of stuff going on, and they get there and they have to say, do I see a gun or not? Okay. And sometimes they see a gun that's not there. And sometimes they don't see a gun that is there. That's the nature of vision. That's the nature of our brain creates what we see. And this happens all the time. I'm gonna, let's see. So I'm gonna show you let's see if I can share my screen. I'm gonna show you another Okay. Hang on 1 second. Um, Okay, so I'm gonna show you an interesting illusion here, if I can do this. Here we go. Okay, can you see that screen with the face, the white face? Okay. So I want this is a mask. It's going to rotate around all the way around. And the mask has two sides, the side that looks at you with the nose pointing toward you, and the side of the inside of the mask with the nose pointing away from you, okay? So I want you to watch the mask as it rotates around and see if you can see the outside of the mask and the inside of the mask. Here's the outside. Oh, wait, that was the inside. All right, now here's the outside of the mask. You see the nose is pointing toward you. Now it's going to go to the inside of the mask and see if you can see the nose pointing away from you. You can't. Because our brains are conditioned to see everything where the nose points toward us, because we've seen, thousands and thousands of faces. And when the mask turns around, it causes your brain to shift and see the mask, the nose pointing toward you. Our brains make decisions on what we see. Okay. How do we hear? Do we hear with our ears? Well, sound comes in our ears, but we hear with our auditory cortex, the part of the brain that's specialized to convert sound into what we actually hear. Have you ever listened to a foreign language, right? You ever listen to someone speaking Japanese or French or Chinese or Russian or whatever? And it just sounds like, just sounds, right? That's because your brain hasn't learned that language. When you hear English, when other people hear English, they just hear sounds. But when we hear English, our brain converts all that knowledge that we gained, it converts it into understanding exactly what people are saying. A couple of years ago, I was at a meeting and a young woman stood up and she said, "Good morning, America," which seemed a funny thing to say, right? In a room of doctors. What she actually said was, "Good morning, I'm Erica." I didn't know her name was Erica. I didn't know anything about her. But my brain was trying to figure out what she's saying. And since I didn't know Erica, it just kind of picked up something I'd heard before, which is a TV show, Good Morning America, right? And so our brains can sometimes get it wrong. Our brains can sometimes create stuff that was not actually there. Have you So I'm going to play a sound for you here.
Can't believe it.
Oops. It takes 1 second. All right, here we go. Now this is a sound.
Laurel, laurel, laurel.
Okay, so what did you guys hear?
Laurel.
Laurel, okay. What else?
Laurel,
Tempted to say Yanni, but I couldn't.
Yanni, okay. Anyone else?
Laurel,
Laurel.
So this is people either hear Laurel or they hear Yanni. It's about half the people hear one and half the people hear the other, if you take 100 people. Why would the same sound be interpreted completely differently by different people? We don't know. But the brain creates what we experience. And for some people, they hear a different part of that sound than other people hear of that sound. So we see what we, and basically our brains see in essence what we expect to see. Our brains hear what we expect to hear. Well, how do we feel? Well, my wife has the same breakfast every morning: sliced apple, yogurt, granola. So a couple of summers ago, she got up early and she had the same breakfast she has every morning. And she had an extra slice. And she came up to our bedroom. It was dark, it was early, and I didn't see or touch the slice. And she just fed it to me and I bit on it. So I'm biting on this and I suddenly get this rotten taste in my mouth. Why would I get a rotten taste in my mouth? She's just giving me an apple, right? It turned out it wasn't an apple that day, it was a peach. And I love peaches, and the peach was actually sweet. But my brain was expecting the crunch of an apple. And when my brain got the softness of a peach, my brain, and this is all subconscious, you can't tell your brain what to do or not to. My brain decided that this was bad. You know, it must be a rotten apple. Right? It only had two options: rotten apple or sweet peach. It chose rotten apple. So I got a rotten taste in my mouth. I experienced something that wasn't there. Have you ever experienced your cell phone vibrating in your pocket when it actually wasn't? That's happened to me, and it's happened to many people. In one study of college students, 90% of people had that experience. So this means that all sensations are actually created by the brain. If you're running across a field and you break an ankle, do you want pain? Of course you do, because if you don't get pain, you'd keep running on a broken ankle. Pain is necessary to protect us. Pain warns us that there's something wrong. Children who are born without the experience of having pain often die at a young age. They get so many injuries and they never know that they've gotten injured. So pain is very important. Pain is a protector. It's our brain's way of alerting us to a problem. Let's say you're running across the field being chased by a lion and you break an ankle. Do you think you'd get pain then? Probably not. Because your brain has to decide pain or no pain. Okay? Our brains make that decision all the time. There's millions of stimuli coming to our brain from our bodies, and our brain has to decide, is this something worrisome or is something not worrisome? Should I turn on pain or should I not turn on pain? And this happens millisecond by millisecond every day of everyone's life. So I have a friend who shot a nail. He was alone at a construction site and he shot a nail in his hand. Do you know how much pain he had with the nail in his hand? None. He had no pain at all. How can you have a nail in your hand and have no pain? Well, I don't know, but his brain had to decide pain or no pain. And probably because he was all alone, his brain decided it would be better for him to drive to the hospital than be alone in pain. So his brain didn't turn on pain. He showed me a picture of his nail in his hand. It was crazy. And this has happened many, many times over history and over the years. So pain is something that the brain creates. Now, the brain can create pain when there's an injury, obviously. And usually it does, but not always. A guy in England was at a construction site and he jumped off a scaffolding onto a nail. The nail pierced clear through his boot, all the way through his boot. He screamed in pain. They rushed him to the hospital. They gave him IV pain medication when he got there. What happened when they took his boot off? There was no injury, it turned out. The nail happened to be between his toes by chance. But his brain saw the nail. His brain turned on pain, but yet there was no injury. And he had severe pain. Was his pain real? Yes, because all pain is real. All pain comes from the brain. And research shows that injuries cause certain parts of the brain to light up when pain occurs. Then research also shows that the same parts of the brain light up when stress occurs. He had stress of seeing a nail in his boot, and his brain turned on pain. Most people get some kind of physical reaction to stress. When we get stressed, sometimes we get a headache, we get a stomach ache, we get a neck ache. Sometimes when we get stressed, I get diarrhea when I get stressed, for example. And I've had back pain many times in my life. I don't have it anymore. I've had neck pain many times in my life. I don't have it anymore. But those pains that I had turned out not to be due to an injury. They were due to my brain turning on pain. There's one more story I'll tell you, and that's the story of a guy I met who was in the Vietnam War as a young man. And one day his company got ambushed and he got shrapnel wound to his leg and he had a lot of pain. He got medevaced out from the field on a helicopter, and he came home and he went to the hospital and everything, and his injuries healed. All injuries heal. So his injuries healed. Now, did his pain turn off? Did his pain go away? That's up to his brain. All injuries heal, but sometimes the brain will turn off pain after an injury. Sometimes the brain will continue to produce pain after an injury. Some people have surgery, for example, and they end up having pain in the site, the scar, the site of the surgical injury for many weeks or months or years later. But it's not because the injury didn't heal. The injury did heal. It's because the brain continued to produce pain. In any case, his brain turned off the danger signal because it's the danger signal in the brain that causes pain. Are you in danger from an injury? Then your brain may turn on pain. Are you in danger from some situation in your life where someone is betrayed by somebody, someone has felt injustice, someone has a boss who's causing a lot of problems, someone has a child who's doing horrible things or whatever. All these things can activate the danger signal in the brain and can turn on pain. The danger signal can also turn on anxiety, depression, fatigue, insomnia, brain fog, diarrhea, all sorts of things. And this is how our brain works. In any case, his brain turned off the danger signal and he was fine, pain-free, he was fine. 20 years later, he's walking down the street and he gets startled by the sound of a helicopter, and he got the same pain in his leg that he had had when he had the shrapnel wound 20 years earlier. The helicopter triggered his brain to activate a neural circuit of pain. What's a neural circuit? A neural circuit is a pathway in the brain that gets learned. When we learn to play the violin, we have a neural circuit for playing the violin. When we learn how to tie our shoes, we have a neural circuit for tying our shoes. When we learn to throw a ball, when we learn to ride a bike, all those things are neural circuits. And his brain had a neural circuit for that pain. It remembered it. And then it activated it with the sound of a helicopter. Some people with pain have pain which is triggered by stimuli which are not causing pain itself, but are triggering the brain to create pain. So I see a lot of people who have pain when they walk or sit or stand, who have pain when there's certain sounds or light, who have pain when they're stressed, who has pain when there's a change in the weather, who have pain when there's cold or heat, or a variety of things that can trigger the brain to create pain. And these neural circuits become learned. And the last thing I'll tell you is that pain can become chronic when there's significant amount of fear and worry and focus on the pain itself. So it turns out that there's a feedback mechanism in the brain. So if the brain causes pain and we worry about it, fear it, pay a lot of attention to it, get frustrated by it, all those things tend to make the pain worse, tend to make the pain spread over time.
Hmm.
And so knowing that, what my method of helping people is first to figure out why they have pain. Is the pain due to physical injury, or is the pain due to neural circuits in the brain? And most of the time, that's not that hard to figure out, because we look at the characteristics of the pain and we determine, is the pain turn on and off, for example. If someone has back pain that goes away when they're on vacation, that's not a structural injury. That's the brain. If someone has pain where the pain in one day is in one part of the body and the next day is in a different part of the body, that's not a structural injury, because structural injuries don't move. Neural circuit pain often turns on and off, often moves, because the brain can turn on one neural circuit for pain, say on the right side of the body, and turn off the neural circuit for the left side of the body, or vice versa, or one shoulder and the other shoulder, or one part of the back and the other part of the back, if you see what I mean. And so we have all these criteria that we use to determine if the pain is being created by neural circuits in the brain, or if it's a structural injury. Sometimes it's hard to tell, but usually it's pretty easy to tell. The second thing we do, of course, is to look at the medical testing. Is there evidence for some damage in the body? Is there a fracture, a tumor, an infection? In fibromyalgia, fibromyalgia has not been shown to have damage in the body. So from my point of view, neural circuits in general, and it has to be, determined for each person individually, but from my point of view, neural circuits are the primary reason for pain in fibromyalgia. And there's a bunch of other things that we do. And then what we'll try to do is help people understand that the brain can cause very real pain. It's not imaginary, it's not fake, it's not all in someone's head. And we will help them to train their brain out of pain, train their brain to change the neural circuits that are causing pain. So that's a half an hour of kind of a general overview of what I do and how I approach things.
Well, thank you, Dr. Schubiner. It's a pleasure always having you come speak to our group again. I'm sorry that we have to do it this way on Zoom, but a lot of my speakers prefer it this way. And plus, with the virus and the variants, it's safer this method. So I think I agree too. So
yeah, it's a lot easier not to drive, I guess. But does anybody have any questions or comments or reactions or anything?
Well, I do have a question.
Yeah.
Cindy, okay. I didn't know if I was unmuted. But sometimes I wanted to tell you that I did take your seminar years ago, and it definitely did help me without a doubt. But the question I have today is, sometimes fibromyalgia is related to something that happened like physically, like a car accident.
Right.
How do you relate that to fibromyalgia, I guess, is what I'm asking, if that makes sense.
Yeah. Well, there's two things that I would say about that. Number one is that a car accident would usually cause pain in a certain area, and fibromyalgia is usually pain in many areas. So if the pain's in areas that weren't damaged, then those pains wouldn't be due to the injury.
Mm-hmm.
The second thing I would suggest is that, as I said before, all injuries heal. So injuries, I mean, we humans have been around for a long time. And we are not designed or created or evolved, or however you think of how we exist, to have chronic pain because of an injury. People have been injured for hundreds of thousands of years, and all injuries heal. The body works to heal the injury. But sometimes the pain can continue after the injury is healed. And when that happens, that's a sign that the pain is due to neural circuits in the brain.
Okay, thank you, doctor.
In the past, I've heard that in trauma and this long-term high stress situations, both the amygdala and the hippocampus will physically change, and that only the hippocampus would return to its normal state over time, and that the amygdala, once activated with sustained stress, remains on high alert. You know, you get the veterans with 1,000-yard stare, and you get people with PTSD that is, you know, intractable. And just last week, someone was telling me about some newer research that the amygdala can shrink back to a normal size. Have you heard anything in that field or that area about the limbic system?
Yeah, I mean, the whole brain, the limbic system is part of the brain. And the whole brain is neuroplastic, which means it changes over time. Our brain is always changing. And it's not so much I think paying attention to the structure is really not that helpful because it's the function. I mean, when people have a stroke, they have tissue that dies, and yet their brain rewires around that dead tissue and can create the functions that it needs to do. So our brain is constantly learning, no matter how old we are, we're always learning. And learning is the basis of neuroplasticity. Learning is the basis of unraveling PTSD, unraveling trauma and hypervigilance and all those things, because the more we practice changing the brain, the more the brain will change. So yeah, I don't, there's no question that there have been studies which show that people with childhood trauma have changes in the brain that last into the adulthood, but those are reversible, in my opinion.
Thank you.
Doctor, is this an autoimmune condition? And does hyperbaric oxygen help people that have had car accidents? A history of, I just caught something on Dr. Phil. There were 2 doctors working with people that had problems with hoarding, and they said it kind of related to they never got better after a terrible auto accident, that they actually could help with people that had hyperbaric oxygen.
Well, you know, car accidents do not produce an autoimmune disorder. Fibromyalgia is not an autoimmune disorder either. Hyperbaric oxygen has, in my understanding, has not been shown to be effective in randomized controlled trials. That doesn't mean it can't be effective. Anything can be effective. What I do when you have a treatment, all treatments have 4 components. One component is an explanation of the problem. And when the treating person, the patient and the doctor have an agreement on what the explanation is, that creates a positivity. The second thing is a method, a technique. The third thing, you know, something to do about it. The third thing is hope and optimism. And the fourth thing is a human connection. So if you take acupuncture, for example, acupuncture works by an explanation which has to do with balancing the chi in your body. The method is to put needles and stimulate those needles. This can create hope and a connection between the person who's doing the treatment and the person getting the treatment. With hyperbaric oxygen, the explanation is, oh, this is an autoimmune condition. Oxygen helps to solve this. Now you have hope. I can connect with you and people will get better. This is what I do, except my explanation is different. My explanation is it's the brain. The brain causes real and often severe pain and other symptoms. The method is to reduce fear and retrain the brain. And again, there's hope and connection. So all healing occurs by these 4 steps, basically. And what works for one person may not work for the other person, because of, you know, what people kind of believe in and what makes sense to them. If a treatment doesn't make sense to you, it's probably not going to work for you. My treatment doesn't work for people who don't, it doesn't make sense to. It doesn't work at all, because they're like, well, this doesn't make any sense. Why should I do that? And it's not going to work. I'm doing, we're doing a research study on back pain now with a friend of mine in Louisiana. And we've evaluated 220 people with chronic neck and back pain. And what percentage of chronic neck and back pain do you think would be structural due to injury to the back? And what percentage of back pain, chronic neck and back pain, do you think would be due to the brain, due to a neural circuits in the brain condition? What do you think?
3% physically.
3% physical
Uh-huh.
and 97% non-physical.
That's my guess.
That's your guess? That's pretty strong, strong guess. Okay. Anybody else want to guess?
Maybe 20 and 80.
80 what?
Non-physical
89. Okay. what do you
and
guys-
and 20 physical.
Yeah. Well, what we found was that 15, you're close. What we found was 15% were structural or physical, 85% were neural circuit. But most doctors would say it'd be 97% structural.
Doctor, that was my guess, actually. I got it right on the button. I was going to say 15% at 85. Wow. How
Yeah,
cool is that?
well, that's what we found. But there was one guy there who my friend evaluated, this doctor friend of mine. And this guy was a longshoreman in Lake Charles, Louisiana. He was 55. He abused his back. He's hardworking, blue collar, great guy. He's had severe back pain, lower back pain. It was seemed very structural. His MRI showed spinal stenosis, which a lot of people have, but it seemed severe, and his pain didn't move, didn't vary. And so my friend thought it was a structural problem. Okay, so he gave him a structural diagnosis. So this guy went to get epidural injections, which he had, and they did nothing for him. And then he went to get something called medial branch block, which is a lidocaine injection in the facet joints. So he got this lidocaine injection in the facet joints. And the purpose of this test is to see if this is the correct diagnosis or not. It's not a treatment. It's just a diagnostic procedure. The idea is if the pain goes away, then that would indicate that the problem is in the facet joints, which are the connections between the 2 vertebrae where they sit next to each other. In any case, this guy's pain went 100% away, 95% pain-free. And my friend saw him a week later, he's still 95% better. He saw him a month later, he's still 95% better. Do you know how long lidocaine lasts in the body? 4 hours. Why didn't his pain go away? Why was his pain gone a month later after a lidocaine injection? The placebo effect. The power of the brain to turn off severe pain. It turned out he was not structural. It turned out he was a neural circuit pain person. And my doctor, even though he was very good at finding neural circuit problems, but even he had an actual structural problem. It's a really interesting story, but for some reason, his brain kicked in and just kicked out or whatever, turned off his pain with that injection.
Wow.
So how do we retrain our brain to change the neural circuits? It's not a one-time thing. I assume it's an ongoing process.
Yeah, it's a training program. It's like how you train a puppy. You know, you consistently have to decide on a message to give your brain, and you consistently over time give your brain the message, and you calm your brain and you reduce fear. This is all on my website. This is all in my books. if you go to my website, unlearnyourpain.com, there's a set of 6 animated videos. They're
Mhm.
short, and we put them together, and you can watch those videos, and it explains all about what I've been talking about, and explains the process of calming the danger signals in
Mm.
the brain. And like I say, it works, and it can work very well when the person who's using it believes that this is the problem.
Mhm.
It tends not to work when people believe that they're actually physically damaged, because it's hard not to be fearful of pain and other symptoms if you think you're incurable, if you think you can't
Right.
get better, if you think that you're actually damaged. You're kind of telling yourself, I'm okay, I'm okay, I'm okay. And it's like you're lying to yourself. That's not going to work. So the first step is understanding this concept. And that's why I spend a lot of time with you today and with all my patients in explaining the ideas of how the brain works and how the brain can produce pain. And then I spend a lot of time with people and kind of sort out exactly what the pain is doing, when it comes, when it goes, how it moves. There's a variety of criteria we use to accurately make this assessment and to help people see it for themselves in their lives.
I assume you work with some patients that have fibromyalgia. Have you had any success with your treatments and helping those people?
Yes. Yes and yes.
It's good to hear, because a
We-
lot of us, we were talking before you came on, we get frustrated with, medical advice and all the things that we've tried, the medicines and the whatnot. And, it gives you hope that there is something that we can try that will help us.
It's very frustrating, extremely frustrating, no question about it. And, personally, I don't think the medical profession understands how the brain works. I don't think the medical profession understands that real pain can come from the brain. And the medical profession, people in the medical profession are afraid of talking about this because they don't want to, if they want to be kind, if they want to be cruel, they'll say it's all in your head and it's your fault. But if they want to be kind, they'll say, we don't know. And, we don't know what to do. But that's frustrating too.
Right.
Mhm.
It gives you hope, that there is something non-medical. I'm saying, right away, doctors want to give you a pill. Here you go. Here's a pain medicine. Here's a muscle relaxant. Here's a, psychiatric drug to help your pain when you could be doing something
Right.
for yourself and more natural.
Mhm.
Right. Yeah, I agree. Yeah. I mean, that's how doctors are trained. I don't blame them. That's just what they know.
Right.
So I did have a session with you, doctor, some years ago, and it was very helpful. But like I said, that was years ago, and I kind of got away from your practices and advice. So I'm gonna have to do a refresher course, go online and look at your materials. But I do remember during the session, you kind of dug deep into areas of your life that maybe in the past or maybe in the present that affect you. That, I mean, there was one particular area that I had no idea that bothered me, which could very well have been some of the source of my pain or symptoms. And it was very interesting, some of the things that you brought out.
Yeah, if there's no doubt that stress and emotional issues, as kind of Ron was pointing out, can activate the danger signal. I mean, that's just being human. I mean, that's how we're designed, we're constructed. So sometimes it's necessary and helpful to look at those stressful situations as
Mhm.
well as trying to rewire the pathways in the brain. Anything else?
I have a question. You used to do the seminars, but the last I knew you were not doing, the group therapy thing or seminars?
I'm mainly working with people on an individual basis now. Yes, that's correct.
Oh, okay.
Yeah.
And due to this pandemic thing, do you do virtual visits?
I do. I do some in person too.
Oh, do you?
Yeah,
Are the sessions covered by insurance?
yes.
That's
Depends
good.
on the insurance, but I work for the hospital, so we take most insurance companies.
No.
Good to hear.
Yeah, so if you need me, you can just send me an email or reach out. And if you want to check out my website, it's unlearnyourpain.com.
Okay.
And like I say, there's some videos there that you might want to watch. They're kind of fun and cute.
Thank you so much, Doctor. You're always a delight to have. And whenever you get a chance, you can send me a copy of the video. I'm sure the group would like to see it sometime. No rush, of course.
I will, no problem.
And thank you for your time and expertise in the field. And we appreciate you taking the time today.
It's my pleasure, you guys. Take good care.
Thank
you.
you.
Thank you.
Thank you.
Stay safe, everyone.
Bye.
Okay.
See you next time. Bye-bye.
Bye-bye.
Bye.